Do you realize that 1 in 3 Americans is at risk for developing diabetes? Over 84 million people, to be exact. Many diabetics are unaware that they are sick. The purpose of today's video is to discuss the prediabetes warning signals. Let's start with troubles with vision and perpetual thirst. You always feel tired. 10. You always feel tired. One of the most typical symptoms is this. There are many various health issues that can cause fatigue, but one of them is the potential presence of diabetes. In this situation, obesity, mood swings, and excessive blood sugar levels may be to blame for your ongoing weariness. According to a study, 68% of participants who had blood sugar levels that were higher reported feeling extremely fatigued. It was discovered that people with high blood sugar levels were nearly 10 times more likely to experience weariness. You have depression. 9. You're feeling down. Millions of people experience depression on a daily basis, and it is one of the main causes of disability. Additionally, there may be a reciprocal association between depression and prediabetes, suggesting that one condition may raise the risk for the other. Researchers discovered that patients with prediabetes, defined as fasting plasma glucose of 100 mg per deciliter or greater, had a 37% increased risk of developing a major depressive illness throughout the course of a 9-year follow-up period. Another study discovered that 53% of participants with high blood sugar levels had depressive symptoms. Depression was nearly 5 times more common in prediabetics than in healthy controls. You can enhance your general health and quality of life by aggressively managing depression and prediabetes. 8. You're having vision issues. You're having vision issues. Blood vessels in the eyes are just one of the many body components that are impacted when a person has high blood sugar levels. Both immediate and long-term consequences may result from this. Fluids will flow in and out of the eye temporarily, causing the eyeball to bulge. When your blood sugar is reduced, this problem can be solved. Your retina, the delicate tissue lining the back of the eye, will eventually suffer from the effects of your broken blood vessels. Diabetic retinopathy is a condition where high blood sugar levels harm the small blood vessels of the retina. The most common reason for blindness in working-age adults is diabetic retinopathy. But prediabetes can also harm the blood vessels in the eyes in a same way, leading to a variety of vision issues as double vision, floaters, and fuzzy vision. Another prevalent reason for vision loss is age-related macular degeneration, which is connected with an increased risk of development in those with prediabetes. Along with myopia or nearsightedness, prediabetes is also linked to a disease known as refractive error, where the shape of the eye changes and light is not focused properly on the retina. Feelings of thirst all the time. 7. Persistent thirst feelings. You will experience dehydration as a result of your body losing fluids due to high blood sugar levels. Excessive thirst, or polydipsia, may result from this. You'll start to feel the want to drink virtually constantly from this point on. Your body will beg for water in particular, but your impulse will be to drink anything that would make you thirst quenching. Avoid anything that could make you more dehydrated, such as soda or coffee, as well as anything that contains sugar, such as juice. You heal wounds more slowly. 6. You heal wounds more slowly. Your blood vessels can affect your circulation in the same way that they might affect your vision. Reduced blood flow to the wound site, which occurs when you have a cut, might delay healing. These wounds might take anything from weeks to months to heal. Additionally, prediabetes, often called as neuropathy, can result in nerve damage. It might result in a loss of feeling in the affected area, making it challenging to identify wounds or injuries. This can slow down the healing process by delaying the diagnosis and treatment of wounds. While a tiny wound can be healed rapidly in a healthy body, prediabetes takes longer. Prediabetic blood sugar levels can also weaken the immune system, which is important for warding off infections. The likelihood of acquiring an infection at the wound site rises when weakened. The healing process can be delayed by infections since the body must spend more energy combating them. Slow wound healing affects about 25% of patients with high blood sugar, which might cause more serious health problems. You get tingling in your feet or hands. 5. Your hands or feet are tingling. This is due to neuropathy, a problem we previously discussed. The nerves that transmit signals from the brain to various parts of the body are more prone to injury when blood sugar levels are high. Damage like this can stop the normal flow of signals, causing symptoms like pain, numbness, or tingling, especially in the hands and feet. If blood sugar levels stay high and the nerves are continuously harmed, neuropathy symptoms may increase over time and result in more serious consequences. You urinate frequently. 4. You urinate frequently. It can be simple to overlook, despite being one of the most obvious symptoms of this metabolic condition. Polyuria, or the need to urinate frequently, is a typical sign of both diabetes and prediabetes. When diabetes was first discovered in antiquity, Egyptian records listed 2 great emptying of urine among the symptoms. The kidneys in a healthy person remove extra glucose from the bloodstream and excrete it in the urine. However, if you have prediabetes, your blood glucose level rises and your body's cells start to resist insulin, which causes your blood glucose to rise. Urine production rises as a result of the kidneys having to work harder to filter the extra glucose out of the blood. This typically entails using the restroom more than 8 times daily. You will experience signs of dehydration when your pee gradually removes fluids from your body's tissues. Furthermore, high blood sugar levels might harm the bladder's nerves, which can also contribute to frequent urination. Diabetes neuropathy, a nerve damage condition, can also impair bladder control and make it difficult to completely empty the bladder. It's crucial to remember that there are other causes of frequent urination, including certain drugs, UTI infections, and enlarged prostates. Unexpected loss of weight. 3. Sudden weight loss. Weight loss that occurs suddenly could be cause for concern. This relates to urinating frequently. With regular urine, your body's glucose level will ultimately drop. This also has to do with how difficult it is for the body to use glucose as fuel. The digestive tract converts the food we eat into glucose, which the body uses as fuel. If you have prediabetes, your body's cells don't absorb glucose from the bloodstream as well as it could. Because of this, the body might not get enough energy from your diet, which would result in continual hunger. Despite having recently eaten, this is still possible. The body may struggle to use glucose for energy if prediabetes is not treated and develops into type 2 diabetes, which would result in persistent hunger and more rapid weight loss. 2. You get itchy skin. The body's excess sugar creates the perfect conditions for yeast to flourish and reproduce. Your skin itches. A fungus called yeast frequently lives in warm, wet parts of the body like the mouth, genitalia, and armpits. The extra sugar in your blood and urine can promote yeast growth in people with prediabetes, which can result in infections. Itching, pain, and burning feelings in the affected areas are signs of yeast infections. These infections may result in rashes, blisters, or pustules, as well as skin discoloration. You develop dark skin patches. 1. You develop dark skin patches. Your body developing strange discolored spots is typically a sign that something is going on in the background. Acanthosis nigricans is the name given to this procedure. At this point, dark blotches develop on the back of your neck, in your groin, and under your armpits. As your skin expands around these regions, the patches are described to feel velvety. While it may be an indication of diseases like cancer or hormone imbalances, it is more typically an indication of insulin resistance, which eventually results in type 2 diabetes. Do you suspect that you may have prediabetes? Tell us in the comments section below.